I'll focus on an anatomical landmark, right? Anatomical term, but before we know anatomical term, we need to know anatomical landmark. So again, everyday term we often use like armpit, but in the anatomical landmark or anatomical term, we don't say armpit, we say axillary, for example. For example, arm, we say brachial. Front of the elbow, we call it antecubital, right? So again, these are the things that I need you guys to start familiarize yourself with it, because in the text or sometime on the test, we'll be using these terms. For example, nasal, you know that already, right? For example, we talk about eye, we call it ocular or orbital, right? You kind of know that. Skull, we call it cranial, for example, right? But there are some terms that I'm sure is new to you guys, right? For example, cheek, buccal. For example, has to do with the head is cephalic, right? So these are the terms that you need to start practicing to use them. Okay, moving on. Then that is the superior, the top part of your body, and there's also the inferior part of your body, right? For example, wrist, carpal, right? Palm, palmar, well, it's kind of close. And then your thumb is pollex, right? So these are the terms that if I mention in the test, you should know that. And that's why this is the slide that you need to, these are the slides that you need to come back and kind of like practice these terms. And we'll have work that will have you guys practice these terms as well. All right, so hopefully, thank you for sharing with me. All right, like moving on. So this is the posterior view. These are things in the back, right? While some terms are repeat, like neck is cervical, head. Shoulder is acromial, shoulder. Back of the elbow is olecranial. So again, I want you guys to start using this note to familiarize yourself with these terms, because these are the terms that we'll be using throughout the year when we do dissection, when we do worksheet, test, and so on. Okay. And then this is the inferior part, the bottom part, but towards the posterior, the back, right? Calcaneal, plantar, right? So there's more. Okay. So beside anatomical landmarks, like different position, structure in the body, we also describe different part of our body through quadrant and regions, especially for the abdominal pelvic quadrant. So you guys, if you guys love math, right? You know that when you do a graph, right? Quadrant, or this is the left upper quadrant, right? Right upper quadrant. Left and right, again, they always refer to the person, right? The person that they are using to describe that is not your left or your right. For example, even though this is my left, but in this person, this is his right, right? Right upper quadrant, for example. Left lower quadrant. So that's what they meant. Beside quadrant, they also use region to describe an organs, right? Or an anatomy in the body. For example, they use epigastric region. Epi means above, right? Gastric has to do with intestine, right? Or there is left hypochondriac region. Again, we will practice these things next week. I just want to go over them quick. Right hypochondriac region. Chondriac has to do with the rib, right? So here. And then you also have lumbar region, like the backbone, your back. So this is right lumbar, left lumbar. Umbilical region is somewhere in the middle here. And why is it important that you know this region? Well, if you're a medical person, when you describe different organ, you want to be specific, right? You don't want to say, it's toward the left side, right underneath the breast, and, you know, that's not professional, right? For example, you need to describe the stomach, the spleen, then you can say this is the left hypochondriac, right? Left upper hypochondriac region. Make sense? So then as a medical person, you know specifically exactly what you're talking about. Understand? And that is the goal of learning quadrant and region. And again, you guys have this note, please practice, right? Take a look at them a lot. And again, we'll practice that next week as well. So beside quadrant and region, we also have directional references. Right? When we show direction, if thing is toward the back, toward the front, toward the top, toward the bottom, and so on. And these are terms that show direction. For example, if you have something that heading towards the head, we call that superior. Right? If something that is heading toward the foot, we call that inferior. Wow. I think most of you guys should know that already. If something toward the joint, toward the shoulder joint, okay, or the joint here, right, we call that proximal, right? Close to the joint, to the body joint. Away from the body joint, distal. That's what we said in the beginning. Toward the body joint, the main joint, the pelvic here, that'll be proximal. Away from it, distal. Lateral medial mean toward the center of the body. If you're moving your arm away from the center of the body, we call that lateral. If you're moving your arm toward the center of the body, we call that medial. Same thing with fingers too. If you flex and you relax, right? You flex, that means your finger are moving away from the center of the body. Flex, away. So we call that laterally. Medial means heading toward. And then of course, the cranial is toward the head. Caudal is toward the tail, right? The bottom. Posterior or dorsal mean back. Anterior ventral mean front, right? So again, this is another thing that you need to practice and learn. Moving on. So beside anatomical landmarks, right? Different position of your body. Directional, right? Showing direction. Quadrant, region. Another way to describe a body is through plane and section. A plane is a three-dimensional axis. We talk about that. A section is how you divide the body. Okay? And this is important. For any of you guys are into like ultrasound or radiology field, okay? You need to know these things. For example, if you are planning to work in the radiological field, like with MRI machine, PET scan, CT scan, and so on, X-ray, for example, you definitely will need to know how to describe section and plane in a human body. So, what are they? Well, there are three terms. When you describe the front, okay, ventral, and the back, dorsal, we use the frontal plane. Just imagine it's a cut. It will section off the front side and the back side. And that is what we call transverse plane. Transverse. Okay. When you are dividing the body to the left and the right side, I mean right and left side, we said we use a sagittal plane. See right here, the blue one? Sagittal plane, blue. Split the body into the left, the right, and the left side. When you divide the body from the inferior, the top, the superior versus inferior, top and bottom, we said that you use a transverse plane. You cut the person transversely to divide the top part and the bottom part. Area, think of like a box. Their job is to protect your very important organs from accidental shocks. For example, like a car accident, like somebody hit you, right? You have body cavity. Their job is kind of like a shock absorbent. Their job is to protect you, your important organ, from the shock, right? It also allows your organ to change size. Think of the lung, for example, right? They inflate, deflate, inflate, deflate, allow breathing. All right, the first type body cavity is what we call the ventral body cavity. Think of ventral body cavity or cavity in front of the body. Ventral is the front, right? The belly side. I meant belly or front, right? Belly, ventral. Remember that term? The front of your body cavity are divide by, you have two cavity, they divide by the diaphragm. The diaphragm is like a muscle that allows breathing. Okay, the diaphragm shape is normally like this. Every time we breathe, it stretch to create space for the lung to expand, and every time we exhale, it go back to the normal shape like that curve. You see, this is the diaphragm right here. The diaphragm divide your body, your ventral body cavity, the front, into two parts. You have the thoracic. This is the thoracic, right? Thorax, the chest area, thoracic. And then you divide the diaphragm divide everything else into the abdominal pelvic cavity. And this is the area that carry all your intestine, stomach, and so on. And thoracic is lung and heart. Okay, so you see. All right, moving on. Okay. So ventral body cavity, it's just a diagram for you to see better. Are then divided into two cavities, right? You have the thoracic, right, which is your chest area. That's the cavity inside your body. They divide into right pleural cavity, which is for the right lung. Pleural means lung. Left pleural cavity more for the left lung. And then you have the mediastinum. Think of it as like your the middle of your chest area here. And then it's around your heart. So thoracic cavity carry your right lung, left lung, and your heart. And then everything else below the diaphragm here, everything else below, we call that the abdominal pelvic area. And this is where you divide to peritoneal. Peri means surround, all right? And then this is also carry your abdominal cavity, which is contain many digestive gland and organ, and then your pelvic cavity. So this abdominal pelvic cavity contain the abdominal and pelvic cavity. Hopefully that helps. Pelvic cavity contain the urinary bladder, your bladder, and your reproductive organs. Right? For example, in female will be ovaries, for example, right? Ovaries in the pelvic area. So yeah, that is the ventral body cavity. Ventral means front or belly. All right, moving on. So with the understanding of the cavity, right? Every cavity, cavity is to protect the important organs, right? All the organs in your body. Each cavity contains two layers, what we call the serous membrane layer. It lines the internal cavity. Every cavity has two membranes. Think of the heart here. Think of the, you have the pericardial cavity, right? That is the part of the thoracic cavity. Pericardial is the cavity that surrounds the heart to protect the heart and also to give heart the space to move. Every cavity have two membranes. They have the internal membrane, the inner membrane that is closer to the organ. And you also have the external membrane. Okay? The membrane that is closest to the organ, we call that the visceral pericardium or membrane, right? Visceral layer or membrane is the one that's closer to the organ. And the one that's farther away from the organ is what we call the parietal layer. Okay? And that is the one farther away. So again, every cavity have two layers. You have the inner layer that is the closest to the organ, and you have the outer layer that is farther away from the organ. Think of the layers like this, a balloon, right? When you have a fully inflated balloon and you press it down, you will see that it creates two layers. So a cavity is double the layer, and the job is to make sure that the organs are protected from shock and allow the organ to move around. And that is the serous membrane layers that surround the cavity. All right, let's focus on the thoracic cavity really quick, right? And again, thoracic cavity carry the lungs and the heart. Thoracic cavity contain the right lung. That would be the right pleural cavity. Pleural, your root word, pleural mean lungs, right? Has to do with the lung. And that's the cavity here that will do cover the right lung. and you have another cavity here inside the thoracic cavity, by the way, that called the left lung. And then this is the back, by the way. This person is facing this way. Okay. And then you also have the mediastinum. Mediastinum is the other cavity. This is the cavity here that it will carry like blood vessel, esophagus, right? Your breathing tube, your eating tube, they're all here. This is the cavity that protected, mediastinum. And then you also have a pericardial cavity. Cardio means heart. Pericardial means the cavity that surround. Peri means surround, right? That's the root word you need to know. Surround the heart. So again, this is like an upper view version. So you're looking down from look down inferiorly. So this image right here is a sectional cut. Right. Abdominal cavity. Abdominal pelvic cavity contains the abdominal cavity, right? This is right underneath the diaphragm. Remember I told you the diaphragm is like the muscle that will stretch, relax when you're breathing. It contains all the digestive organs, right? Digestive organ. Okay. And then within your abdominal cavity, you have the peritoneal cavity and the abdominal cavity, right? The peritoneal cavity contain like different part of your muscular body wall. It also contain pancreas, kidney, ureter, has to do with the urinary system, and part of the digestive tract. This is your pelvic cavity right here, and the rest are your abdominal cavity, because they carry all the organ, digestive organ. Pelvic cavity here, on the other hand, carry reproductive organ. For example, ovary in female. Also your rectum and also your bladder, right? Your ureter, your bladder, all the organs that make up your urinary system. All right, I'm gonna skip, and that's it.